Hello, everybody. Welcome back to the conversation series.
Because creators are businesses.
What we do is not simple.
Give, the fans everything that they deserve.
Being creative
is like doing a 5,000 piece puzzle.
is something that you can learn and do over and over again.
Always be as authentic as I can be.
Hello, everybody. Welcome back to the conversation series. I am thrilled today to have Sarah Crawford here with me. One, she's the CEO of TLC right here in North Carolina, and she's also a North Carolina House Representative. Sarah, thank you so much for joining me today.
Oh, I'm so happy to be here. Thank you. Thank you for having me.
Yes, I am excited to jump into TLC. And first, I just want to hear, you've been with them 5 years now?
Coming up on 5 years.
Yeah.
So about 4.5 years I've been CEO.
Okay.
I just told this story earlier today. I'm a Boomerang employee. So I worked there many years ago in a different role and took a 5-year break, still worked in the human services space, kind of adjacent to higher education, and realized the error of my ways. And
Came right on back.
Yeah, came right on back home. Came right on back home. That's right.
What attracted you to TLC?
I have always been very motivated and very driven to service. And so I had started my career kind of in the government side of service, that government space, worked for a member of Congress, did constituent services, and parlayed all of that experience into a nonprofit career which is where I've been for 20 years now. Yeah, I started when I was 4. Anyway,
Beautifully done.
Yeah. So, but for the past 20 years, I've been in nonprofits, and just prior to coming to TLC, I worked at Duke Children's Hospital. And so, just saw firsthand just the experience of families. If you are a family that needs Duke Children's Hospital, you are living in some pretty hard times. And I really wanted to get closer to that work, and saw the opportunity to go work at TLC back in 2011, and then now back as CEO.
Love it. Will you set the stage for everybody what TLC is, what you guys focus on, what your main mission is there?
Yeah, so we were founded in 1969, so coming up pretty closely here on 56 years this summer. And we were founded out of really mothers' love for their children. This was at a time when you had a child with disabilities. You were told to take your child to an institution, go on about your life, or do your best to care for that child in their home. There just were no services really available. And those founding families said, this is not good enough. This isn't good enough for our families, for our children. And so they founded this organization really to support their children, but to support all the families who were having that same experiences. So we serve children and adults with intellectual and developmental disabilities. And what started as 3 families now serves nearly 1,400 families a year. So we're pretty proud of this work. We do a whole array of services. I like to tell people that, we're lifelong support services. We work with children, we work with adolescents, we work with adults. We have residential services, therapeutic, we have care navigating services. So we really try to be that one-stop shop. And if we are not able to provide support, we get a referral to another agency. Yeah,
it's one of my favorite things that I've gotten to do in my life. Is I spent 8 years working at the YMCA, and specifically in the aquatics, and working with Camp Grace. And so my absolute favorite part of my job was these kids. And I love to tell everybody, I'm like, these kids know no hate. All they know is love. And it is my absolute favorite thing that even my dad today, he works in healthcare, and the sector that he is on is helping government, military families who have kids with autism or developmental disabilities to get the care that they need. And so my family has really in some way touched all of the helped these kids, and it's just one of my favorite things that I've ever gotten to do in my life is work with these kids.
I love this. Well, we'll have to have you out to TLC and show you what we're doing there. That is awesome.
I love it. I'm like the kid, you learn so much from them too. You learn incredible amount.
We have a board member who got connected with TLC in the 90s. He and his son were in a car accident, and his son was left with a traumatic brain injury, lived for about another year and a half, but they couldn't care for him in the home. And so we fortunately had a spot for their son, and he came to live with us for the last part of his life. And that family, 30 years later, is still very involved. And Tom Morrison is his name, and he wouldn't mind me sharing that. Tom says to everybody that comes to learn about our mission, whatever you put into this mission, you will get 10 times or more back out.
Yep. I love that. I want to dive into what you guys are doing at TLC, and just, you have this residence village and it's described as this replica model.
Yeah.
If it were a startup, might be called a prototype in some sort of, that's how I kind of see it in my mind. What did you learn from the first iteration that surprised you with this residence village?
Oh my goodness. This project has been an undertaking since 2018, really. Wow. So even before I came back as CEO. And so I came in and it was underway. And so we've been working at this for quite some time, and we just opened our brand new residence building, our new residence home, about 2 months ago or so. And so, during the process, some of the things that we really did, and we had a great architect, BSA, who helped us out. But we really studied the staff movements in the homes that we currently provide. How staff move about, what were the pain points for staff about, even things like where you keep the lift. We have all this enormous equipment that needs a home. Yeah. And so, I think one of the big things that I learned is just all the attention to detail that was necessary to give this new home all of the things that our staff needed. And I knew, again, as a nonprofit, you kind of get really good at being make-doers.
Yes.
Right? We make do with what we got.
Yep.
And our staff is pretty incredible. And I don't think I realized until we built this new building how much make-doing they were doing. And they're doing incredible work, by the way, make-doing with what they had. But, even things like our laundry room. The laundry room in our pre-renovated homes, 47 square feet. With these big, monstrous machines, because we do so much laundry. But it's part of dignity, right? It's part of living with dignity and making sure the people we serve can live with dignity. The laundry room in our new home, 150 square feet. Go. It makes a difference.
It does.
For the residents and for our staff.
Yeah.
So just, the thing that I learn, that I relearn every day, is how much our staff truly love the clients.
Yeah. I like the make-doing. It's make-doing.
Yeah. Yeah. We're make-doers. And the best nonprofits are the best make-doers.
Yeah. Yeah. We think of innovation as this like shiny, tech-driven thing now today in today's world. But you're innovating care and community. What's the most radical idea TLC has put into practice lately?
Oh my goodness. I think when I think about innovation and the kind of innovating that we do at TLC, I'm so glad you said what you did about, we think of it as this big, shiny.
Yeah.
I think it happens in the everyday moments in how our staff care for our clients. Yeah. Truly. Now that doesn't mean we're not doing some innovative things. But truly, I think it's just these beautiful everyday moments. And because the folks that we serve, they communicate differently with the world. They move differently in the world. Sometimes it's about how the staff really get to know that individual. Right? Those eye blinks mean something. Yeah. That gaze, all right, that gaze off to the corner says, I am done with this conversation. Right.
I gotta go.
Right. And so when you're working with a community of folks who have disabilities in the ways that the folks we serve do, the innovation really comes from that human and personal interaction and really getting to know the client. And some of the ways that we've gotten to know our clients, we also know that there are some technology needs that they have. And we've done some really cool things in our new building. One of the coolest things I think we've done is every single resident room has its own air handling device.
Oh.
I've learned a lot of construction terms.
Okay.
It's called a VRF system for all of you listening. But what that does is it allows every resident to have that room the way they want it. Just like I might not want my house cold like my neighbor keeps it, right? I can have my house the way I want it. And so giving people that choice, that freedom, and we have clients who are hypothermic. They cannot regulate their own body temperature. And so you will see, even sitting outside on a summer day, they might be piled in blankets. And so really important that they get to have the room the way they want it, the way they choose it. So I think that's a really cool thing that we brought into this building. Our bathrooms are unbelievably loaded with technology. We have these huge bathtubs that go up and down, which alleviate the pressure on the staff who are supporting these clients. They are very safe. They're temperature controlled. The water's all temperature controlled. And just that art of being able to soak in a tub, like how relaxing is that? We're taping this on a Friday afternoon, and I'm kind of thinking, what am I going to do?
Sarah might do it today at the end of the day.
Right? But just, I think the things that we take for granted kind of every day, we have to provide that same support to the folks that we serve, the folks that call TLC home. And we're able to do that through these pieces of technology that really allow us to meet people where they are.
I love it that you point out the different temperatures of the room, because it's the biggest debate in the world is what you keep your temperature at in your house.
Right. What do you keep yours at?
Right now it's at 72.
Okay.
It's air. I've got the air on.
I
had to move. I was like, okay, we've been fluctuating, but now we're finally at, it's hot.
Yeah.
It's warm.
Hot.
Yeah.
We're at 7. We keep it at 70.
Okay.
So, but that's important,
It
right?
is.
Right.
So
like
important.
the fact that we're just having this conversation, and the way that the people we serve interact with us, they can't just tell us
sometimes.
that. And so our staff get to know these clients so well. And I think that's where the innovation happens, because they go, you know what? This person would really benefit from an eye gazing device that can help them communicate differently. Right. I've seen how they can look at things and they can pick an image with their eyes. And so, just having that knowledge is so important.
I think it's one of those things too, that at night when you're sleeping, like you're either, some people lean hot and cold. It's one of those things that it's just those little itty bitty things that people don't think about that are important, especially for this community and this group.
I
love that. If a community leader from another state called you tomorrow and said, we want to build our own residence village, where would you tell them to start?
So I think what I would say is, what I would want them to know is, do you know the needs in your community? Now, what I can tell you is that there are huge needs across the country. There are huge needs here in North Carolina for residential supports in a variety of ways, and we can explore that. But I think you really have to understand, what does the community need? How can we build to meet that need, and to meet the growing need? Right? Because in North Carolina, over the next 10 or 20 years, we're going to have a 38% increase in the number of people that need our services. And so I think you have to understand that when you build a residential community, you have to build it for the needs of today, but also the flexibility of whatever those needs are going to be tomorrow. We have a lot of folks that started with us when they were children, 6, 7, 8 years old. And now some of those people still live with us today, and they're in their 40s and 50s. And so, I think you can never build something big enough. So I think really planning for what that looks like as people grow, as their needs change. So just like all of us are aging, unfortunately, our needs change as we age. The same thing happens for this community. Medical needs change, mobility needs change. And so really planning for that flexibility, I think, is important. And that's what we've tried to do here.
Now, what I love is that there are other opportunities in the community that you see, like people working at Harris Teeter now. You see these opportunities. Is there any part of TLC that are helping with opportunities, or is this truly a people who really need the most sort of help day in and day out?
So at TLC, our residential community is really for individuals who have significant need. So we have our homes on our campus that are for those individuals who need around the clock personal care, nursing cares. We have RNs, LPNs, CNAs. We have the whole gamut of healthcare professionals that work with us. We do have group homes, and the individuals that live in the group homes are able to live a little bit more independently. We do have some folks in our group homes that go to volunteer opportunities. They ride the bus and they go and they come home, and we do support individuals in doing that. And then we have a number of home and community-based services that we provide in people's homes. Or therapeutic programs that we provide where we are supporting people in building individual skills so that they can have more opportunities out in the community to go to work, to go to volunteer opportunities, to be active members of their community. And then the last thing that we do that I want to mention is we have a care management program. And what care management does is it provides navigating support for individuals who are on Medicaid. So we have all these statistics that show us that people who are on Medicaid do not have as good health outcomes as people who aren't. And part of that reason is there are all these other social determinants of health. Access to transportation, access to healthy food that are really barriers to those folks living their healthiest life, to getting access to care. And so we actually do in-reach into the community to talk to folks to say, hey, are you getting the care you need? What are some barriers we can address? Do you want to work? Can we get you connected to a supported employment program so that you can work? So we do a lot of those services as well.
I love that. I love that there's different avenues. So it's that people can, whether or not they want to or not, there's different options and things for people to be able to take advantage of.
Very important. Very important that we make sure everybody can choose where they want to live. They choose how they want to work, who they want to live with, and where they want to go. And we try to help folks of all abilities to navigate that.
I love that. Now, I know there is a wait list for TLC.
Yeah.
What does that process look like? Are there more resident villages being built? What is that kind of growth look like?
I wish. We need them so badly. So there's a couple, when we talk about the waiting list, there are a couple different waiting lists. And so I'll try to break this down as digestively as possible. So in North Carolina, there are more than 18,000, almost 19,000 people who are on what is called the Registry of Unmet Need. And it is an official list that the state of North Carolina keeps of individuals who need the types of services like TLC provides. But they don't have a slot. They don't have an innovations waiver yet. And the state has to open up those slots and fund more of those slots in order for folks to get their services. So we keep pretty close tabs on that wait list. There are other services that you can qualify for while you're waiting for services. Those are some things we can work on at the state level. At TLC, we have an interest list of over 100 people that have said, I want my son or daughter to live here at TLC. So when an opening becomes available, please put us on your list. And that process, we don't have openings very often. We provide lifelong care. As long as we can continue to serve the need of the person who lives there, we will continue to do that. And if their needs change, we will work with our partners to try to get them the supports that they need. So when an opening comes available, we will reach out to the families on our interest list, and we stay in touch with them if their needs change. One of the biggest challenges that we're having right now is, and what we're seeing is the number of people who have been able to provide care to their loved one in their home and now the parents are aging.
Yeah.
And so we see a lot of parents who are in their 70s and 80s who are now looking at what's going to happen to my child when I'm not here. And so they're reaching out to us to get on our interest list. And we take into consideration all kinds of factors. We look at the family need. We have to look at the fit of the house and who else lives in the house and make sure that's a good fit. That's really important. And of course, we look at, are we the right place to provide care to this individual, or can we make a referral to another organization? But the fact of the matter is, we need more services across the state of North Carolina so that families can get the supports that they need.
Yeah.
Because when you have a child with disability, it doesn't just affect that one person.
Yeah.
It affects
The whole family.
the whole family.
Yeah.
And so so when you are doing these services, you're not just serving that person with disabilities. You're serving the whole family.
Yeah. I want to just hit on the nonprofit world. You've spent a lot of your life in the nonprofit world. It's a world that is known for not moving very quickly. And as you were describing, it's a make-doer kind of world. Yeah. What's something that the nonprofit world understands about care that the policy world often misses?
So I think what the nonprofit world understands is how to provide the care.
Yeah.
Really on the ground experience. And, I straddle both of these worlds. Yeah. And so it's always very interesting to me when policymakers are putting to policy and they don't involve anybody who's actually going to impact in writing it. And so there have been a lot of times when I've said, no, this isn't going to work for the people who are providing the care. This is not going to work. We need to do this differently. We have such just dedicated caregivers in our organization. I went around to all of our programs when I first came back to TLC as CEO to just understand from the staff, what were we doing well? Yeah. What did we need to work on? What was motivating people? And I got a lot of input. People were very open with me.
I'm sure they were.
Especially about what we could be doing better. And, but I asked them, I said, what keeps you coming back? Because I will tell you, these jobs don't pay what they deserve to be paid.
Yeah.
It is hard work.
Yep.
It is hard physically, and it is definitely hard emotionally. Yeah. And I asked our caregivers, I said, why do you come every day? I came back into this organization during a global pandemic. Yeah. So not only was it physically demanding, emotionally demanding, but then we had this global pandemic that came back. And to a person, every single staff person said, I love the clients. And I said, okay, then I need to love you.
Yep.
Right. I mean, what do you say? I love the clients. Okay, well, we're going to figure out how to remove barriers so that you can do all the work you know how to do. Yeah. And removing barriers looks like some of these renovations that we're making. Yeah. Making the laundry room bigger. Right? Like, and again, that doesn't seem like a big deal, but it is such a big deal. Yeah. Right? Making the nursing station open so that those nurses have visibility and they don't have to get up from their desk 800 times to go check on clients. They can see what's going on. Right? So we took all of that input and put it right back into this building. And I think it's important to take all of that input and put it into the policy side as well. And, again, these people who work at TLC, everything that you and I do, they have to help the people that live at TLC do. Yep. And so, in these jobs, when I first started in this industry, these jobs were getting paid $9, $10 an hour. And you can certainly go work at Chick-fil-A or McDonald's for more than that, not have it's 24-hour care, right? You don't have all of those same responsibility. So we've worked very hard to bring people up to a living wage. We need to keep working at that. We've been able to do that very well at TLC, but that is not the case across the board because these positions are just hard and they're hard to recruit for.
It's a difficult thing. I was in healthcare for 3 years and even the conversation today, nurses just in general, not being paid enough, not being paid for the incredible work that they are doing. Yeah. I think it's still one of those things that is completely missed on, that they are doing the Lord's work there.
Yes.
And it deserves to be paid.
It absolutely does. We had a parent that was involved with our organization, still is involved. And I heard him speak one day and he said, none of us parents chose this path we're on. We did not choose to have a child with disabilities. Yeah. Every single one of these workers has chosen to do this work with a child with disabilities. Yeah. And so, he really just impressed upon me how important it was to really take care of the people who are doing the caretaking.
Yeah. It is, it's one of those things that I continue to try to speak up about. I think it's my sister who is in nursing school for her own sector of the world just to get her RN. And I mean, she was seeing a lot of things and just the amount of time that she was there. She's certainly had some experiences where she's like, these people aren't paid.
Yeah, that's right. And we've tried to break down a lot of those barriers. Yeah. We've looked for ways that we can save as an organization so that we can invest in the staff. We've created some career pathways opportunities so that our workers can see a path for themselves into kind of a team lead type of position. Again, just trying to take care of the people who have chosen this work and help them see, I can make this a career, right? I can be a supervisor. I can be a director one day. I can, maybe they'll lead a nonprofit one day. I mean, I really want TLC to be a place where, no matter however we are on your stop, right? Yeah. Like if we are part of your journey while you're getting your degree in college, if we're, just a stop, where your career choice, I want us to be the place that we can really invest in our people and say, you know what, I got really good training there, and boy, did I get to do some amazing work.
Yeah, I love that. And I want to go back to a little bit of part of the origin story. TLC started with 3 families. Yeah. They wanted more for their children. How do you feel like you're carrying that origin story forward into the future?
I carry it on my shoulders every day. And, I think in 2 ways. One, I feel so much like I'm standing on the shoulders of giants who had the forethought to create. They didn't just create a place for their 3 children. Yeah. They knew that we would need to be there for families who may never understand that they were going to need us and then come to need us at some point in their lives. Right. Disabilities doesn't know socioeconomic barriers. It doesn't know geographies, right? It can hit and it doesn't, it's not always something you're born with. Yeah. Right. It can happen as an accident or something else. And so they knew that we would need to be a place, that would need to be there for their families. And so I carry that with me every single day. And we were founded, I should mention, as Tammy Lynn Center, who was the daughter of one of our founding families. She never lived at TLC. She passed away when she was 12 before we started as a Mother's Morning Out program in the back room of a church in Cary. And I just feel so proud of where we've been and how far we've come, and the fact that we've got a board and supporters and family members and staff who are all working at every turn to make sure that here in the future. And that's what it really takes.
Yeah.
And so we're trying to tell as many people as we can about the work we're doing.
I love that. Now, almost 56 years, when you think about legacy, not just your own, but TLC's as well, what do you hope people will say about the organization another 50 years from now?
I hope that people will say that TLC is now a statewide organization. And we have brought our model to every corner of North Carolina, that we have supported agencies for whom, there's been a lot of changes in Medicaid.
Yes.
We could probably talk for an hour just about that. But it's getting harder and harder for smaller agencies to stay open because billing is much more complicated. You the amount of money that comes from Medicaid is not enough to cover care, which is why we raise money to cover that. And it's just getting harder and harder for the smaller agencies to do that. And I'd like to believe that we can bring our model into these communities that are at risk of losing their disability services and help support those communities, because we do have a model that is successful, where we've been able to invest, where we've been able to grow. And so I hope that's what people are saying in 50 years.
I love that. I would, every corner of the state.
Yeah.
I would,
maybe the country.
Yeah.
Who knows?
50 years, who knows what could possibly happen around here. One of my last questions for you, Sarah, if you had unlimited funding for 1 year, no red tape, what's the first thing you would build, expand, or launch at TLC?
Oh, that's such a good question. And what a gift to be able to dream that way. If we had a year of unlimited funding, I think I would do several things.
Okay.
The first thing that I would do is I would build more housing for people with disabilities, and I would build an array of different types of housing. So you need places where folks can get very high personal nursing care, which is one of the programs that we provide. We've talked a lot about it today. You need housing where people can live independently but supported.
Yep.
You need housing for families. So I would invest in more housing options for people with disabilities. And I would invest in career pathways to recruit more people into this line of work, because you can't open more services and not have the staff to do it. So I think those are the two things that I would invest in first.
I love it. It goes back to the 50 years, all
50 years.
All the corners.
We're in every corner. We're in every corner. But we need people to know about this work and help us spread the story. So
I love that. Sarah, I can't thank you enough for joining me today and walking me through what you guys are doing at TLC and what you guys are continuing to do for the next several years. So thank you so much for joining me today.
Well, thank you. This was absolutely my pleasure and such a delight to be with you.
Yes. You guys, I'm going to have all of TLC's information down below, Sarah's information. Please go give them a follow. Stay in tune with everything they're doing. And as always, I will see you guys back here next time. Bye, y'all.